The next person on our list is Raisa Khalid. I wanted her to speak. Raisa is an intern who's been working with me. She's a high school student from South Windsor High School, and she's been working with many of the disability community advocates, and they actually requested that she speak. So that was from the request of the disability community who have been she's been working with for the past many weeks. So Raisa, you're on.
Hello, I am Raisa Khalid, and I go to South Windsor High School, and I intern for Dr. Saud Anwar. I'd like to thank everyone for letting me be here today. Let me ask you all a question. Let's say you went to a medical center to get a special x-ray. It's crucial to determine your diagnosis, but the technician says, nope, can't do it. It might be good for you, but it's not convenient for me. How would you feel? Enraged, oppressed, marginalized? Sadly, this is the bitter truth of what happens to nearly 11% of Connecticut's population. Under Dr. Saud Anwar, I investigated the 29 hospitals in Connecticut, contacted medical professionals, and spoke with remarkable people with disabilities. It has all led me to one conclusion. We need to create policies for disability-friendly services in healthcare facilities and ensure appropriate medical diagnostic equipment. From my investigation, I created a website that has my findings and a map. The map displays all the hospitals in Connecticut. When you click a hospital location, it shows information about the disability accommodations the hospital claims to have. However, after interviewing people with disabilities, I found that the hospital's information can be misleading. In addition to interviewing people with disabilities, I also interviewed medical experts such as Dr. Peter Deckers, the former dean of UConn Health, and Dr. Mary Beth Bruder, a professor at UConn Health who works for the Center for Excellence in Developmental Disabilities. My findings from these interviews were absolutely astonishing. Jay Toulin was the caretaker of his late wife, Nancy, who was in a wheelchair with a disability and weight issues. Nancy went to the doctor's office, and the doctor said, "You can't get on my exam table. You'll break it." Rachel, a kind, sweet woman with cerebral palsy, never saw a wheelchair scale at any doctor's office, except for one, and they didn't use it. And she has never gotten a proper mammogram, except once, when there was a properly trained technician. She also told me that she can't remember the last time she was on an exam table. Suzanne, similarly, was given ultrasounds instead of mammograms due to her disability, which is not the right process for a breast examination. The imaging facility even told her, "We no longer take wheelchairs. If you can't walk in for the visit, we can't have you here." Jamie was never taken onto an examination table. His doctors told him that blood work tells you everything. This is not a fact. You can't check for sores or any crucial issues if your patient is not on a table. All these stories are just a drop of water in an ocean. They all highlight that whether it's mammograms, lifts, special scales to measure weights, there have been disadvantages and technical limitations for the disabled. Furthermore, almost everyone I interviewed claimed that there is not enough space for wheelchairs in doctors' offices. The medical professionals are not trained enough to accommodate people with disabilities, which, as Dr. Peter Deckers claims, greatly hampers access to medical diagnostic equipment. The problems span from structural, equipment, and training barriers. Before I leave the stand, I would like to express my gratitude to speak here for a cause that must be addressed. Please visit my website named Disability Friendly Services in Hospitals, or DFSH, where I posted a 10-minute video that explains and expands on this problem. And I'm grateful to be here today. Thank you all very much.
Thank you. Thank you so much, Raisa. You've put your heart into this whole effort. We're very proud of you because you've put in hundreds of hours of interviews, conversations, and research. So thank you for your work.